Good morning. My name is Millene Camilo. I'm a neurologist and a board member of the ESF Young section. Today, I have the pleasure of interviewing Professor Eckeli, Head of Sleep Medicine at Ribeirão Preto Medical School, University of São Paulo, Brazil. We will discuss the paper Inequalities in the Access to Diagnosis and Treatment of Obstructive Sleep Apnea in Brazil, a cross-sectional study, published in the Journal of Clinical Sleep Medicine. Welcome, Dr. Eckeli, and thank you for accepting our invitation. Could you tell us about the context and objectives of your study?
Our study aimed to address a critical gap in understanding the availability of a diagnostic and treatment resource of obstructive sleep apnea with the Brazilian health system, SUS. Brazil, as one of the largest and most populous countries globally, faces significant challenges in providing equitable healthcare access. The objectives were to identify centers offering OSA diagnosis and treatment within the Brazilian health system, evaluate regional disparities, and analyze the capacity of these centers to meet the population needs.
Methods were used in the cross-section study to analyze disparities in access to sleep care.
Specifically, this study employed a two-phase cross-sectional design. In the first phase, we developed and piloted a comprehensive survey with one question, focusing on diagnostic and treatment resource for OSA across Brazilian health system centers. This survey was distributed via professional networks and Sleep Medicine Association to centers across all Brazilian macro-regions. In the second phase, additional centers were contacted after our preliminary findings were presented at the Brazilian Sleep Congress. Data selection relied on self-reported questionnaires and cross-reference records from 2018 to 2019 period to ensure accuracy and comprehensiveness.
Interesting, very nice. In Brazil, we have a public health system. Could you explain how the system works?
Brazilian health system is a publicly funded universal healthcare system designed to provide free access to medical services for all citizens. It operates on principles of universality, equity, and comprehensiveness, with funding and management shared among federal, state, and municipal governments. However, resource distribution varies widely across regions, leading to disparities in healthcare access and outcomes, as seen in our study on sleep apnea care.
And what are the main inequalities identified in access to diagnosis and treatment for obstructive sleep apnea in Brazil?
In our study, reviewed a significant regional disparity in obstructive sleep apnea care. Diagnostic capabilities and treatment availability were concentrated in Southeast, while regions like North and Midwest were underrepresented. Diagnostic tests per 100,000 inhabitants ranged from 1 to 14 annually, and treatment rates varied similarly. Access to PAP systems or PAP therapy was insufficient, with many patients relying on legal actions or out-of-pocket payments due to the gaps in public funding. Additionally, long waiting periods for diagnosis and treatment initiation further highlighted these inequalities.
Finally, what strategies do you suggest to improve these inequalities in sleep care?
To address these disparities, we propose several strategies. One, increasing public awareness of sleep disorders to drive demand for diagnosis and treatment. Two, implemented validated screening tools to streamline the identification of OSA cases. Three, expanding diagnostic capacity by incorporating the simplified tests like home sleep apnea tests for a hypertest probability case. Number 4, enhancing funding mechanisms for pipe therapy to reduce reliance on legal injunctions and out-of-pocket expense. And 6, developing regional programs to decentralize care and provide equitable access, especially in underserved areas like in the North and Midwest areas. This measure could significantly improve access and quality on sleep care systems in the Brazilian healthcare system.
Congratulations, Dr. Eckeli. It is a very interesting study, and I invited everyone to read it. Thank you. Have a nice day.
Thank you so much.